Good evening, ladies and gentlemen. My name is Pamela Roberts. I'm going to speak to you today on the benefits of healthcare reform for small businesses. Healthcare costs have been increasing dramatically, and according to Kaiser Family Foundation, the healthcare sector is growing faster than any other sector of the U.S. economy. In the last 10 years, health premiums have increased by 131%, workers' contribution has increased by 128%, and inflation has gone up by 28%. Small Business Majority and the U.S. Chamber of Commerce confirm that small businesses are burdened by these increasing costs. I saw firsthand the frustration of my former employer, who complained of how her premiums had been increasing and how she could not afford better coverage. She had to pick a plan with a higher deductible in order to afford coverage. Research shows that healthcare reform will help small businesses with their current challenges by reducing administrative costs, creating a health insurance exchange, and strengthening businesses. The root to most small business challenges is insurance discrimination. Insurers do not like to cover small businesses, so they increase premiums so the businesses are forced to drop coverage. This was confirmed by a testimony by Wendell Potter, who testified before Congress. Insurers conduct more medical underwriting for small businesses when compared to larger businesses, which results in increased administrative costs and premiums for small businesses. There are limited insurers who cover the small group market. In some states, only one insurer could control the market, which forces small businesses to settle for mediocre coverage. Let's talk about the benefits of healthcare reform. Healthcare reform will reduce administrative costs by 1. Saving small businesses on broker fees, 2. Reducing administrative costs that are driven by medical underwriting, 3. End the hidden tax of $1,000 that businesses currently pay, 4. It will introduce tax credits for small businesses, and 5. Healthcare reform will limit the amount insurance companies are allowed to spend on administrative costs. Secondly, healthcare reform will create a health insurance exchange which will 1. Help small businesses purchase insurance from the same market as larger businesses, enabling them to select better policies. 2. Limit the amount of expenses, out-of-pocket expenses that small businesses currently pay. 3. Prevent insurance companies from raising premiums without cause. 4. End insurance discrimination. And 5. Give small businesses access to high-quality care. Finally, healthcare reform will be able to create stronger businesses by 1. Improving employee wages, 2. Increase business competitiveness in the healthcare market and in the job market, 3. Increase business profits by saving the money, 4. Removing the job lock by making insurance portable, and 5. Better wages and savings will unlock business potential. Please take a minute to look at the chart in front of you. This data was provided by Howard Associates, who were commissioned by a Business Roundtable to look at healthcare through the eyes of the private sector. They looked at the status quo, and they looked at restructured market, which is reflected in purple, and they looked at legislative changes. The amount reflected here shows the amount the employers are paying per employee. In 2009, the amount was $10,743. This amount in 10 years will increase, if the market stays the same, to $28,530. And if it's restructured in purple, the amount will go up to $23,151. And if legislation changes occur in green, the amount will go up from $10,743 to $25,435. As you can see, this will be a lot of savings for small business. It'll be if legislation changes occur, the savings will be $3,000. If the market is restructured completely, the savings will be $5,000. Further studies reveal that reduced administrative costs and taxes and the creation of health insurance exchange will result in a premium reduction of 4 to 12%. Healthcare reform will indeed help small businesses overcome the current challenges of high premiums by reducing administrative costs, creating a health insurance exchange, and strengthening businesses. The Congressional Budget Office and Dr. Gruber, an economist commissioned by Small Business Majority, all confirmed that healthcare reform will really save businesses on their premiums. Reduced premiums will unlock great potential in small businesses because they'll be able to afford to pay better wages, retain current staff, and attract better workers. They'll be able to save money, stay in business, and work on making their business greater. Those that were hesitant to start businesses will finally be able to start business. This is especially important since small business is an engine of innovation in the United States. Innovation leads to job creation, more businesses, and a strong economy. Thank you very much. Does anyone have any questions?
Yes, Ms. Roberts, we would like to know, what is an attractive pool?
An attractive pool is a group of people who are coming to be insured, who have a group big enough that has a diverse group, where there are enough sick people to balance out, enough well people to balance out the sick. So, since some businesses do not have a large number, they generally do not have an attractive pool.
Also, we would like to know, what is a plan with high deductible?
High deductibles is a plan that has lower premiums, but the problem is when someone goes to the doctor, there's a set amount that a person has to pay until the insurance company can pay off for benefits, and this amount could be a lot. So that's why these plans are not very good. Thank you.
Good job.